the presentation uploaded in the computer. We had some issues because of the a speaker actually had a problem with the plane. His plane was actually cancelled, and so we have a bit of changes in the organization of that session. So Michal Krzyżanowski was stuck in somewhere in between Poland and Cartagena. I hope he will arrive sometime, but it's not going to be on time for that session. And I'm trying to take time for Pierre to finish the presentation and to upload that. So we'll have I don't know about the exact schedule. If everything in the day is delayed by half hour or so, I don't know when we are supposed to finish, but we will start. The idea of that session, which is co-organized by WHO and WMO, is to give you some flavor of what we do and what we consider important in the topic of monitoring air quality. Why do we need the observations? Which kind of observations do we need? Which are the technologies that are promising and that can be used in the future? And I know that there are some expectations from many people to know a bit more about how low-cost sensors can be used. Okay, thanks. How low-cost sensors can be used. And we would like to, with this session, to illustrate how we go from observations to health assessments. We will try to give some practical examples of what has been done in a few cities. And we will have then a session that is organized in a way where we have then two presentations. Then we have some time for a panel discussion, which will be moderated by my colleague from WHO, Pier Paolo Mudo. By the way, I'm Paolo Lai from WMO. And then I hope that this panel discussion will trigger some discussion from the public and that we can engage with the time that we have into a fruitful discussion with everyone. So we will start, and I would like to introduce our first speaker, who is Beatriz Cardenas. Beatriz works for the World Resource Institute. She's the air quality director there in Mexico. And she co-leads the global air quality effort of the World Research Institute. She's an expert in air pollution, and she's bridging the science and the policy to advance the clean air solutions. She used to work as a general director of air quality management in the Mexico City, and she led the air pollution research at the National Institute for Ecology and Climate Change there. Beatriz, the floor is yours, and you have exactly 10 minutes, or 8 minutes plus 2 if you want to have questions.
Yeah. Well, thank you, everyone. Good afternoon. Thank you for the invitation to share some of the work that we have been doing over the years. So I will talk about some tools for air quality measurements with the idea of raising awareness on the health impacts of air pollution. So I will say that when sometimes when we are so into the monitoring, I will say from the side of the air quality monitoring people, we tend to forget why we measure, why we monitor. And we focus so much on having the instruments working and implement, but the monitoring is just a tool. What is important is the data. So what questions are we trying to answer with the data? That's important. Because based on the questions that we would like to answer with the data, that's how and what type of monitoring we have to decide. So examples of the questions that we would like to answer with air quality monitoring is what is the ambient concentration in different parts of the city? Are we meeting our air quality standards if we have? What are the health impacts due to exposure to air pollution? And of course, with that data, health experts can assess what is the health impact. For instance, on how who will be most impacted. Just some examples. And I will just share with you some examples of, 4 examples of studies that um, some of them, and you will see, and the idea was to make an order of the oldest to the recent one. And I will talk very briefly about one of the first study that was done to evaluate the impact of an intervention in Mexico City was with the first BRT, the bus rapid transport. I will talk very briefly about a participatory science study that we did in León, Mexico. And then I will talk about what we have been doing. It's a big research, a big project, the Clean Air Catalyst, that was just over a month ago. And that was considering as part of the reference monitoring station. And then I will just very briefly make an example of the Canary Alert using data to bias correct it. So this is one of the first studies I mentioned that was done between the Embark Mexico, used to be WRI Mexico now, and it was in cooperation with the National Institute of Ecology and Climate Change. And what we wanted to assess is what was the exposure, changes in exposure of people, the passengers in the old vehicles. It was a minibus and a diesel bus. And what was the difference when the first BRT line was finished in 2005. And it was very interesting to see that, yes, people inside the buses will have a reduction in the concentration that they were exposed to during the time of the transport. And the whole idea was just to show that this type of intervention, in addition to the emission reduction, they may have an impact of those who are inside the vehicles. In that time, we designed the study to evaluate what will be the change in ambient concentration. We were not able to see that. Over the time, what we have seen is some of the monitoring stations nearby that BRT line 1, where, you can see that some of the ambient concentration were reduced. So this is just an example. It's a paper. It's quite old, but it's one of the first one. In that time, we were using what it was available in that time. So it's almost 20 years ago, if you can imagine. So we were using, in that time, we didn't have local sensors. So it was actually, we were sampling the particulate matter with a pump and the carbon monoxide, and we'll take also samples of VOCs in a canister. Right now, there are many, many options if you want to try that question. So what we only wanted to show is that in addition to the benefits, there may be a risk reduction for those who were spending time in this transportation. To be honest, we did that study and we were very happy, but very few people in the transport sector knew about that study. So that's one of the things when we ask the question is who is going to use that. This is another example done in León. We were asked by the municipality and the state of Guanajuato, and they want to do a baseline for a low emission zone design. So we wanted to know what is the exposure level to ambient concentration in pedestrian and cyclists in due to vehicular emissions. We used, in that time, what we partnered with the Edinburgh University. They were not exactly local sensors, it's that actually research sensors, but they were allow us to have the instruments in to evaluate ambient concentrations as well as personal exposure where the people was walking or cycling. These were instruments that allow us to measure less than PM 2.5 concentrations, very rapid resolution of the sampling. So you will be able to, by moving and walking, you will be able to see the changes in the, and I think that, yeah, this is a page, so you will not see the. So again, the whole idea is the intervention that was planned in León, it was to design a low emission zone. So what we wanted to have the baseline, once the low emission zone was established, you will come back, do the measurements, and you will be able to show, yes, there was a reduction in ambient concentration in the area or personal exposure. You may not be able to see the changes, that's for sure, and you have to be at least to know what will be the changes, and the instruments that you are using, they have the resolution and the precision that you require. Sometimes that happens, that you are not able to see the changes because the instruments were not right, or sometimes you are able to see, yeah, there was a reduction of 10%, 20%. That doesn't mean that you are able to maybe to evaluate the exposure, the risk of health assessment, but at least you will know that that specific intervention helped. What has happened with low emission zones is that you may be reducing the concentration of the exposure inside the low emission zone, but maybe you move the emissions outside and some other people may be impacted negatively. So that's something that has to be considered in those type of designs. And this is just the story that we have been working over the last 4.5 years in the Cleaner Catalyst. It's a project made by a consortium of many partners. It was co-led by EDF and WRI, but we have many partners. Some of them are here, so happy to see Vital Strategies, for instance, Sumi here. But what we did is that we have different questions. We, in these 3 cities, Indore in India, Jakarta in Indonesia, and then Nairobi. In each of the same cities, what we wanted to have is that more to know what was the ambient concentration and eventually what was the exposure and health impacts. So what we decided is to go with the reference monitoring stations, and we designed a complementary monitoring system. That is that we identify where the existing monitoring stations were, and we expanded. We identify what areas of the city were not covered, and then we identify the best site. And just as for an example, well, at the end, we have 3 new monitoring stations, reference monitoring stations for PM 2.5 and meteorological parameters in Indore, adding to the 3 that they have. 2 of them were high volume, and there was only one of automatic monitoring stations. So here I'm just trying to show that in order to have reference monitoring station, in this case was just to complement the existing air quality monitoring station of the cities. With reference monitoring stations for PM 2.5, we have to design where and define where, what areas of the city these monitoring stations will be located. So this is just an example that we look at areas first. We look at where the most vulnerable, the people in vulnerable situation may be that will not have any coverage of monitoring. And we eventually look at the places, of course, evaluate it was the best place. We talk to the local government because after the project is over, the instruments will be given to the local authorities. So just an example, what we did, we were very careful in having air quality monitoring, quality assurance and control, of course, the equipment not only well designed, I mean, the site where they were located, it was well designed, but also all the quality assurance, quality control. And the last one, this is just an example of using data. This is a project that we wanted to use existing monitoring data of many cities, to use this as to do a bias correction of the output of a global modeling, the GOCF. And in this case, you have an output that is being generated by the NASA GMO team. And we use in several cities, we use the data from that cities in order to make a bias correction. So right now we have an application, a web app in which you can see, we have checked if the data, well, first we have to check that the data was in good quality. And that's, we found many surprises. The data, even though it's a lot of work of operating this monitoring station, you need to have a quality assurance, quality control. So there was a very good example. We also use, in the case of Kampala, Kigali, low-cost monitoring sensors. From the whole array of local sensors, we just were able to identify a few of them that not only have a good quality assurance, quality control, but also they were representative. We didn't want to use this data to bias corrected a model, like if the data was coming from street traffic. So those are the examples that we have. I will say that first is what is the question that we want to make, and then what is the monitoring design, and of course the instruments. And as always, it's very important to do the quality assurance, quality control. Thank you.
Thank you very much, Beatriz. I think it's very important that we see how the regular high-quality monitoring networks can be complemented by additional work, and the examples that you are giving apply to many, many places. It's not only about Mexico or about specific cities. So this is great. Sorry for rushing a bit. The second speaker today is Mark Parrington. Mark actually works for the ECMWF, which is the European Weather Organization. He is involved in the Copernicus program, which develops services for different kind of users based on the information that is received from the different countries, European countries. But obviously, Copernicus is not only European and treats global issues. So, Mark, you have 10 minutes also, or 8 minutes. When you see me approaching, it's bad sign.
Okay, thanks, Paulo. Thanks for the opportunity to be here and to present the work we do in the Copernicus atmosphere monitoring services. What I'll talk about. I'm coming at this purely from the air quality, atmospheric chemistry side, and hoping to make some connections for where we can better engage with the health community through the next couple of days. So I'm going to start by taking a huge step backwards. Not much in the side meetings yesterday or today yet has talked about satellite observations, but these are observations which are essential for doing the kind of work we do, which is providing global forecasts of weather and air pollution. There's a lot of text, too much text. I'm not going to read it, but basically, satellite observations are critical. We wouldn't be able to do what we do without satellite observations. However, there are limitations and obstacles that have to be overcome in the effective use of satellite observations. And what we do in CAMS is by combining these observations from different sensors with models, we fill in gaps and we provide value-added products which do all the hard work for you. So, and the bottom line of the Copernicus Atmosphere Monitoring Service and the larger European Copernicus program is all the data, whether satellite data or from the services, is fully open access and free to download for anybody to take and do what they want to with it. So this is in the wrong order, I think. This is a schematic to just illustrate how an operational system for providing global air quality forecast information works. So here at the very top in the middle, we're running basically a weather forecast model into which we include atmospheric chemistry, the source and sink terms for atmospheric pollutants. On the left-hand side, we take emissions from inventories, but in some cases for forest fires, wildfires especially, we're using satellite observations available in near real time. On the right-hand side, we see then where the satellite observations come in. We go through this data assimilation process, which is statistically combining the observations with the model, taking into account all the uncertainties and the sensitivities. We do this for a number of atmospheric pollutants. So AOD is aerosol optical depth as a proxy for particulate matter, but ozone, carbon monoxide, nitrogen dioxide, sulfur dioxide. At the bottom half of the slide, we feed boundary conditions to 11 regional air quality models for the European domain. And in this case, we also take in surface air quality observations and assimilate those in a similar way as we do with the satellite observations. This is mostly based on regulatory networks, but there is potentially a role for low-cost sensors. I'm not going to talk about this, but just to mention, we are making our steps to trying to understand how we could use low-cost sensors, and hopefully this leads into what Chris will talk about for OpenAQ in the panel discussion. And again, like Beatrice said, those in situ Measurements are essential for validation and verification, and they need to be independent. So that's why we don't assimilate them in our global system. So this is where we're using these kind of data from different sources. It gets very technical very quickly, but this is the most simple way I have of sort of illustrating how this works in practice. So we take our satellite observations on the left. All those white spaces are gaps in the orbits or gaps where there's cloud, so there's no observation. But we do this combination with our forecast model to provide what we call an analysis, and that's then used to initialize every subsequent forecast. So we're taking initial conditions from the satellite observations, and then we know that we have the optimal knowledge of what atmospheric pollution looks like at the start of the forecast, and we can run that forward 5 days. And then we do this iteratively every 12 hours, basically. So midnight and midday UTC, a new forecast is initialized. And we get a picture like what we have way over on the right-hand side. This is a case for carbon monoxide last September, so we can see in the red the smoke from coming from South America. I'm going to go back 2 slides. So just another comment on the use of in situ data. For Europe, we're very lucky. We have this very rich and very dense in situ network from regulatory networks, but also from ground-based LiDARs and different sensors that look at the atmosphere in different ways. And we leverage this information as much as we can, either in operational context or in the validation context. And this also then feeds into various European collaborations managed by the European Union, European Commission. The data is also used in, sorry, this is completely mixed up. And the data in action then goes out into various international activities. So looking at the transboundary conventions, looking at the methane pledge, the sustainable development goals, as we heard about this morning. And so our data is being found in a lot of these places. If you have an air quality app on your phone, chances are that forecast uses our data as well. It may not be exactly our data as we deliver it, but in some form, this is going into a lot of air quality applications. I think it makes sense to just illustrate a couple of examples. So these 2 animations are showing in the top, smoke transport from Western Canada across North America and North Atlantic to Europe in July of last year. This also included some detectable signal in surface measurement sites in the UK and Western Europe, just from this smoke transport. The bottom one is Saharan dust, mineral dust from the Sahara crossing the Atlantic and reaching the Caribbean. And then the quality is not great, but either side there's time series which are comparing the forecasts against measurements on both sides of the Atlantic. And you probably take my word for it. Actually, the agreement here is pretty good. We get the magnitude and the timing of these peaks when they arrive at the measurement sites. And then just to illustrate 2 photographs that sort of show these hazy skies in relation to these events. In addition to, so we, as an operational data provider, we don't really deliver anything in terms of health metrics, but we do now have activities through contracts within Europe only, but as examples of where this data can be downscaled to then provide urban scale information on air pollution and air quality. These are some examples from Bulgaria, Italy, and Germany along the top. The bottom left, we also have policy tools where we can start to calculate the contributions of natural pollution sources, so mineral dust essentially to PM10 at different cities across Europe. And then on the right-hand side, it's not one of our examples, but there's other companies using our data, taking the open access data, downscaling, and then in this case, this is for Sarajevo, and this is also using OpenAQ data in combination with CAMS data to look at street level air quality in Sarajevo. So if we start at the bottom of this slide, so in terms of policy tools, we have a website that provides various tools that show how the data can be used to understand better air pollution contributions, including source apportionment, sector contributions, chemical regimes, and sliders in if you want to change the emissions to see how pollution would change. The Copernicus program is also running a series of data hubs. The health hub is operated by CAMS. and basically brings the data from across the Copernicus services together under this theme of health in this case, but there's also for energy and some other activities. And this also covers then physical health aspects, mental health aspects, and so it's meant as a one-place resource for all the information for Copernicus relative to health. Excuse me. And then finally, we also do a lot of communication activities around our data. My day-to-day work is checking our forecast, seeing how well the forecast is performing on the fly where we can, but also where we can push that data out to users to show, A, that the data exists, and potential applications and potential uses under different pollution scenarios. And this goes, CNN International Air Quality Index is based on CAM's forecasts. And we also talk about forest fires, mineral dust transport, volcanic eruptions, the Antarctic ozone hole, and we have a lot of activities there. And just the final remark is what I hope personally to get out of this next couple of days is where we can better support and better provide our products in a way where health professionals or the health community can also use our data, and where we can support and where we can boost each other in terms of getting the messages out there on how the atmosphere is changing, what the impacts are. So thank you again.
Thank you very much, Mark. I think that if the data is available, meaning that the data is accessible and the data is shared, then institutions like yours, aggregators of information, can provide added value services, which are extremely important and that can be used by any kind of users, even at the local level. So this is really the message. And now I pass on the floor to Pier Paolo Mudu, who will be chairing the panel and introducing the panelists.
Thanks, Paolo. Thanks, everyone, for being here. This is, as you see, is a quite important sessions because we are putting together the work of people that are doing apparently different things in a way or another, or similar things in a way or another. So I invite the panelists to come here to the stage, and we have prepared a set of questions for all of you. Okay, I think we. Oh, I see. Okay. So we start with Lydia. So the first question is for Lydia. If you want to introduce also yourself quickly, super quickly. And you're from Queensland University of Technology. And we have prepared a question on why monitoring air quality is the first step in developing public health policies and strategies to reduce pollution and protect health.
Thanks for the question. I guess we've answered this question many, many times already since the beginning of the day. I'd like to start with an analogy. Imagine that you are a medical doctor, many of you are probably here, and a person presents to you for a checkup. But you cannot order any test, you cannot measure any test, absolutely, you're looking at the person. So you're asking the person a question, are you all right? Do you have any symptoms or anything? No, I'm right. All the questions are fine. So basically the person is fine. So then you may start asking questions, what's the lifestyle of that person? Are you smoking? Are you drinking? Are you doing exercises? Well, if the person is smoking, perhaps the person may have high blood pressure, but no way of telling this. So basically, the bottom line is that without measurements, you have no idea, and this person could have very high blood pressure. One measurement would establish this. Well, the analogy only goes that far, but if you move now to air quality, if you see, well, if you don't see, means that's fine. Well, no. concentrations of PM2.5 can already be over the WHO guideline, and you still can't see it. You cannot see ozone. For example, did you see if air quality in the lecture hall was good? Did you see it? And I can tell you, because I do measure CO2 concentration, and it wasn't good. It was over 900 ppm. So the fact that you don't see doesn't give you any information. If you can see, okay, there's a problem, but where is it coming from? Excuse me. If we are talking about outdoor air, well, there are cars on the road. Perhaps it's coming from somewhere else. Perhaps it's some domestic combustion. Well, no idea, but you cannot guess based on what's happening somewhere else. I spent the last week visiting family in Buenos Aires. Buenos Aires, well, you know what it means, good air. Now, it's a very different situation in Buenos Aires, plain, dilution, dispersion. But you go on the other side of the continent, Andes, pollution accumulates. So the same emissions could be here and there, yet meteorological, climatic, topographical conditions completely change this. So you cannot tell anything. So then what can you tell? If you cannot measure, what can you then tell on this scale of health problem? How is the population affected? How many people are affected? And if you are a decision maker, you must know this. You cannot make the decision based on who you think there's a problem. You cannot quantify this. And further, you cannot quantify what is the cost. Ultimately, for decision makers, cost is the issue. Well, you can say finally, all right, I know that there's a problem. Let's put some regulators. Let's put standards and regulate, mandate the standards. Well, if you cannot measure, you cannot regulate, put regulations, because part of the regulations is measurement. So you cannot do it. And then the last point is, if you cannot measure, so how are you going to establish any decisions about the time scale of this? If you don't know whether the problem is here or there, regulations will always have the time scale. So you don't know whether it be since tomorrow or since from 10 years later, what the cost would be. You can do nothing without measurement.
Well, thank you very much, Laura, Lydia. This is the best beginning for us on public health. So, but as we are mixing here experiences from different disciplines, air pollution is a multidisciplinary environment, unfortunately, or luckily. So we have Laura Gagliardo from the University of Chile. An honor to have you here again. And the question is, what is your experience on the integration and use in policies of data on air pollution from satellite?
Thank you very much. Buenos días. Muchas gracias por la invitación. Thank you for an invitation. Happy to share this podium with people I know from literature or from some co-writing on emails, but not in person. But the experience is, first, yes, we need in situ measurements. So that's the first step in order to understand the exposure of people to air pollution, but also to understand the processes that accompany the final impact on health. And typically in our societies, and I'm talking now in South America, particularly with the flavor of along the Andes, of the western side of the Andes, is that people try to copy and paste what is said by the EPA, or what was said by the EPA, and first they put sensors where people are. And that's very good for understanding the potential impacts. However, it's not sufficient in order to understand processes. And in that respect, the combination with modeling as the one shown at the global scale, but now at the regional scale or the sub-regional scale, combined with observations provided from other platforms, particularly satellites, it's a good tool to move forward. But one has to be careful because sometimes these tools haven't been validated for particular regions. I remember some 10 years ago, we were using satellites, MODIS satellite, to try to infer the seasonal cycle of particulate matter over Santiago, and it was upside down. And the reason was that we were very close to the Andes, and the reflectivity of the surface was impeding a better inference of what the actual situation was. So, and I would say that there is a growing use, and these tools and data are becoming easier to use, more and more available, and there is the other problem that sometimes we are overwhelmed by data. And one has to find the good data and the data that is pertinent to the problem you are dealing with. And for having legislation, in particular, one has to have in situ data still. So the other parts are complementary information that is more intended, I would say, for process understanding.
Thank you, Laura, very much. And when we set up this panel, we wanted to have literally the different experiences of all kinds. And I think Michael Johnson can give us a very particular perspective. I have the longest question for you, but it's easy, I think, for you. Can you describe the importance of understanding low-cost sensors' utility and limitation to provide air quality information, and how they can be integrated in air quality management strategies, also to raise awareness and advocate for cleaner air? I'm not going to repeat it. It's 1 minute.
Yeah, maybe there's a little time left for me to talk.
Go quick.
No. Thanks, Pierre. Yeah, so nice to see so many friends, and it's great to be here. So I'm going to talk a little bit about more of the programmatic side, about how we use information from low-cost sensors or low-cost sensors. And I have kind of two stories that I maybe want to tell to illustrate how we use this data and how we think about this data, especially making it really powerful. I'm going to start with a question for the audience. How many of you have worked on maybe a bigger project and it's taken a lot of time, and you write a report or a paper or something, and it goes off to whoever it's supposed to be with, and then that's it? Yeah? Yeah, right? I mean, the work might be satisfying, the work might be good, but the impact is either too abstract or just not there, right? And I think we probably all had that experience, and doing big research projects or big studies are really important. They help build, epidemiological foundation of what we're doing and all these things. But I found some of the most satisfying projects I've been involved in have been small, targeted projects. So I did one with an organization called WEACT in New York City, where it was a very small project. It was only 20 households. And we didn't use the fanciest instrumentation. I won't call it low-cost sensors, but it was certainly good enough to measure what we need to measure in these 20 households. But it was done with a great advocacy team from WEACT and really good research team as well. We worked with Columbia, Darby Jack's team there as well. And it's also done at a time when the New York Housing Authority was evaluating whether or not they want to ramp up a program with induction stoves in their housing, as well as legislation that was going through the Congress at the state level. And so the timing was perfect, and we were working with a really good team, and even though it was just 20 households, the results from that directly fed into decision-making at NYCHA to, in fact, yes, let's try and get 10,000 induction stoves into our housing stock. And we believe it also helped with some of that legislation in the state of New York. And this was, this was a shoestring budget using not the most sophisticated instrumentation, but it was really powerful and really satisfying, right? So when I think about, and this has been reiterated by, I think, a lot of folks here, like, what are you actually trying to do with the data? What is the quality that you need? And sometimes what you need is data that's good enough, but it doesn't need to be perfect, especially if it's targeted and it's the right time and location for application. So I think that's you know, when you're thinking about the programmatic side of things, you really have to think, what quality do I need, and is this going to help, you know, move things along? And then just very quickly, the other place I work mostly in household energy. When we think of low-cost sensors and these distributed networks, they provide, you know, information that might be good during wildfire season, things like this. But we don't often think about it for household energy programs, like at the household level, where you might have a results-based finance program, for example, try and get revenue streams in there, and they're always asking for more data, more data, more data, especially with as it relates to health. And right now, we try and rely on models or these big studies that either one of them, they don't really work very well when you're thinking about how do we actually demonstrate the health benefits of our program, right? And so this is a real opportunity, I think, for low-cost sensors where, yeah, the data from each individual sensor may not be the highest quality, but if we do enough QA/QC that we believe the exposure is being benefited by these programs, you know, that's probably enough for results-based financing, for saying, yes, we are actually having an impact, because in the absence of that, what we rely on now are things like surveys or models that are not so great, or hopefully, you know, some big funding pot of money, and those things just don't come around that long. So anyway, I probably take up too much time, so I will stop there.
Okay, no, thank you. And we have another two panelists here, and Sumi Mehta from Vital Strategies. And the question is you have a lot of experience, and do you have examples or lessons learned from cities from different regions demonstrating effective air quality management strategies and how the diverse waste monitoring data has driven action? Yeah. Thanks.
Thank you, Pier Paolo. So I just would really love to build on, I think, what the other panelists have been saying, maybe to give a slightly different aspect of the work, because I think what we've heard a lot about the data collection and the enthusiasm for really having these good integrated data systems, right? So moving beyond the reference grade to the satellites, to the low-cost sensors, but really thinking about how we can meet places where they are with respect to the current level of data and capacity, but most importantly, thinking about what are those questions, as Beatrice noted. What are the questions that we're really trying to answer? And one of the important things I wanted to emphasize is that we're just not thinking about collection of data, but really thinking about how can we use these data, not only for the analyses to measure the impact of what we're doing or for research, but also to communicate to the public. And so I just wanted to mention in several places, really now around the world, we've seen there are several city networks, whether you think about the Partnership for Healthy Cities, which is implemented by WHO and Vital Strategies, or you think about now the Breathe Cities initiative, where we really have an opportunity to think about, you know, how can we really enhance the communication of data? And one thing that I wanted to emphasize, so I'm thinking about examples of cities as diverse as, let's see, we have Fortaleza, Bucharest, Jakarta, a few more will come to me as I'm discussing. I just forgot, but there are many cities, very different types of cities, but one very innovative way that when we think about the communication of data to the public, an important thing, because of course we here are very technically oriented, we're thinking about collecting and using these data, but the public also wants to know how this data are affecting their health. And so, you know, we need to think on the one hand also a lot of interest in air quality alerts and forecasting, but of course as public health people we know that it's also the long-term exposure to air pollution which makes a difference. And I think we need to think a little bit creatively about how we can also communicate beyond just thinking about changes in the short term. The other thing that I wanted to quickly mention is a very innovative way that some of the cities have started doing this to ensure the sustainability of their efforts, which is to basically write into the legislation that they have a responsibility to communicate about air quality and its impacts to the public. And it's much more kind of, I think, appealing many times to the policymakers to think about this. And then if you have to communicate about air quality and its impacts, you also have to monitor and measure the air quality. But sometimes it's more effective to start from saying we have a mandate to communicate these data, and in that then we also have the mandate to collect the data rather than emphasizing just the technical aspects.
Well, thank you very much. And I think with our last panelist here, we go more on this communication. You need data. And so Chris Angerbaumer, OpenIQ, simple question for you. How much is important in your view is making data findable and accessible?
Thanks for the question. Great to be here. I also brought a little personal monitoring advice. So I have a question for the audience. This data that says what the quality of air is at this given time in this room. Let's say Laura got up and she walked up and she went over to Salon Dos and she told them what the air quality was in here. Would that be confidential, or is this actually kind of public data? Nobody wants to answer that question. I guess I would say that the quality of air at any given time or place is something we all have a right to know. If we have a right to clean air, we also have a right to know what's in the air that we're breathing. But secondly, if we make the data, if we share the data that we collect, what we do is we provide more opportunities for everyone to be part of the air pollution solutions. Whether you're part of the public sector, the private sector, the civil society sector, you bring a diversity of talent, experience, knowledge to the table that can build off of that knowledge, that air quality data, and conduct all of those use cases that our speakers and others have spoken about earlier. If you hoard the data, you are the only one who is working with that data. And there's just so much value out there that can, again, be built upon that data. So my organization, OpenAQ, what we do is we go out and we search for open data around the world, and then we ingest, we aggregate that data, and we harmonize it because data is very disparate. So we harmonize it into a single format on an open source, open access, free database so that scientists, researchers, data-driven communicators, community-based organizations can take that data and again help us solve this crisis essentially. We're particularly interested in government data because that tends to be the highest quality data. And I'll just share quickly, we do a biennial report looking at national governments around the world to see, number one, are they monitoring air quality? Number two, how kind of on a scale of 1 to 10, how open are they with that data? Unfortunately, we found 36% of countries in the world are not monitoring for air quality at all. And then secondly, this sort of scale of openness, and AQI is excellent, helped to share with the public a visual way of sharing with the public what the air quality is, but it's not, we need the actual real measurements for the type of science and so on. So a completely open data, we found just over 1/4 of the world's countries are providing that maximally useful data. So, so our goal, and I think the goal of everyone in this room, is to let's share data when possible, and then we will get to the answers and solve this problem. What was the earlier 2020, 2040 half of the air pollution? But let's solve it faster, like everyone in the room wants to.
Thank you, and we will have some time for question and answers. And before then, we have Sergio Sanchez from the Environmental Defense Fund that I can give you one microphone. Okay. Okay. I made a mistake. He discovered a Miniature one that is in another session with me, not in this one. But as he has very interesting story and slide, we prepare. Are you going to put my slide? I think it's a. There is no. Oh. Let's see. Oh. No. Oh. It's not. That's
Okay.
okay. Go because you will be tomorrow in the transport session.
Excellent.
Okay.
Very good.
That's not here. There tomorrow.
Okay.
Okay.
Very good. So I am going to appeal to your imagination. We are talking about data, numbers, but we are not going to imagine numbers and data at this time. But we are just going to use numbers and data to imagine why we are using these technologies. EDF, my organization, Environmental Defense Fund, is thank you. It's a pioneer in harnessing innovative technologies to make air pollution visible. And by saying visible is not because just to make it physically visible, because we want to make it visible for the public, for the communities affected, for politicians, that this is something important and there is a way to understand it. We want to make it traceable and actionable, and among other things, enable real-time hyperlocal insights on pollution hotspots and sources. I'm going just to use this slide. This is the City of London. As you may know, the City of London is one of the most monitored around the world. It's like 120 monitoring sites, but still there are areas that need to be well understood. So between 2019, 2020, EDF collaborated with CAF, C40, and the mayor of London, with Mayor Sadiq Khan, to deploy a hyperlocal monitoring network comprised by hundreds of sensors in order to improve the understanding of the London downtown. In order, the original intention was to understand what was going to be the impact of the implementation of the ultra-low emission zone, and the mayor wanted to see this in terms of pollution reduced in London downtown. But in addition to that, one of the advantages we had was the possibility to identify sources that were not even mapped before, because these are not traditional sources identified in traditional emission inventories. And just by the fact to have this more hyperlocal approach, it was possible to identify these areas. And why this is important, not just to know that there is a problem, but as a result, the Great London Authority determined the need to develop specific policies to control these emissions, not just in this area, but everywhere else in London and other parts of the country. So integrating data from ground, aerial, and satellite sources is very important. Strengthen evidence-based decision-making, among other things. Just let me finish by saying that at the extent we are able to understand at a higher resolution problems, we can also be able to identify solutions that are closer to people. There are many areas around the world in which air pollution is not being measured. Not just in the global south, but even in the north, in the global north, there are these areas, and this is an alternative. And thank you very much. Much to say. I am available if you want to talk further.
Thank you, Sergio, and apologize for some confusion. And I think Paolo will take back the microphone, and we start with question and answer from the audience. I think we have 10 minutes. 10 Italian minutes or 10 real minutes, how it works.
We can be the Italian minutes since we are both Italians. So first questions, and also think about the fact that you can ask questions to the first speakers as well, not only to the panels.
It's a question for Michael. No, because yes, we can have air quality monitoring networks, but people for this teleworking new situation of our societies are living more inside. No? So what about indoor pollution sensors monitoring that makes sense for people that are in the screens? I don't know. In average, I'm 12 hours in the screen. So what could be your recommendation, Michael?
It's a good point. Leverage all of us that are tied to our phones, right? Turn something good there. Yeah, no, really good question. So something that we do have as a resource right now are maps that show you whether or not a monitor is placed inside or outside. Purple Air does this, for example, and there have been some really interesting analyses about how indoor environments have changed during wildfire events, for example, versus outdoor. But from like a personal level and trying to understand the data and figure out what actions need to be taken, turning on air filters, opening windows, all those things. This group of people, I'm sure that we have some sense of what to do in those situations, but I think there's a public health outreach component that is largely unmet right now. I'm on the air quality advisory board of my city, and most of what we do is think about how can we actually get people to make informed decisions about their exposure, because as a city, we can't affect wildfires, we can't affect the oil and gas emissions that are happening nearby. All we can really do is provide behavior change strategies and information to our population. So I think that's still woefully lacking, and we have, I think, a lot of data and tools available, including our phones, but I think the biggest gap there is probably just behavior change and education.
Well, what we are working very hard on is on the introduction mandating indoor air quality standards. Without this, nothing's going to happen, because it's not a behavioral change. If PM 2.5 is high here, in this room, what are you going to do? Is it coming from here? Is it coming from outdoors? So you, as an individual, you cannot answer this question. So indoor air must be mandated the same way as outdoor air is, and the fact that we have these sensors, low-cost sensors, we can already do this. We've published a paper last year, which is a blueprint for mandating indoor air quality standard. So this is really a solution. Without this, not much will happen.
Thank you very much. I think we have another question. You can introduce yourself, actually.
Sure. Thank you. My name is Soumya Singh. I'm an assistant professor from India, Indian Institute of Forest Management. So I worked on a low-cost sensor network in India, and we deployed more than 300 sensors. And our project called Samosa, one of our colleagues is here. And so the thing is I have a question for everyone, and especially OpenAQ representative, that, okay, so I'm all for open source data, and as a scientist, I really believe in that. But when we are deploying these many sensors, and these are really helpful and useful tools, but the data quality, as a scientist, we understand that this low-cost sensor is not really low-cost when it comes to the maintenance. And we really have to keep checking the data quality every time, and actually not even a 1 week situation like in India, we need to sometimes replace those sensors. It could be based on the it's a electronic issue, or actually PM loading because of the high level of pollution. So in that case, what happens, it's coming from a real story. I'm not going to name the district or whatever, but what happened that if your data is open, okay, it's giving, and let's say it's started measuring something absolutely not acceptable number because of the mistake of it, because of any problem in the sensor and pollution level, because there is certain limit for the sensors to measure, right? Let's say for purple air, they mentioned that it cannot go beyond 500 microgram per meter cube. So my question is, in that case, it becomes a misleading for somebody who is actually seeing the data in public. And as a scientist, we understand, okay, we have to calibrate it, we have to correct it. But when this is going on a public platform, what's your suggestion? I really struggle with, and it's a really ambitious project. And then, you're working in a country, and then government is always watching you, you are reporting in your paper or something. So I think it becomes very challenging to keep the open source data in that case. So can you please comment? Thank you.
I really appreciate that comment, and you're not the only person who feels that way. This is why we think it's very important. Well, we made a decision that we need to provide the data as is, because scientists around the world have different methods for their own kind of quality control and quality assessment. And we are basically neutral in that field. We do intend, if we get the funding, to build some algorithms that will help people do QA, QC, but that doesn't really answer that question of an individual looking at the data. And I think we just need to decide, are we doing more good putting the data out there for the world when there's occasionally a mistake might be made? We also have that sort of the opposite, like we were talking with the government in Ghana, where there was this report, oh my gosh, this is the worst air quality in the world, because they were just looking at a low-cost sensor. Well, the government hadn't opened up its data on its reference monitor. Had it opened data on the reference monitor, they could have said, actually, our higher quality monitor does not show that the air is that bad. So we kind of have to have a full ecosystem that again, I think the reference monitors, that information is the most important, but there's again, it kind of gets back at what is the question you're trying to answer. With low-cost sensors, they're really, really great for engaging the public and getting that basic information to say, we have a problem here. Maybe we need more monitoring with higher quality instrumentation, but we actually have some information for you, decision makers. Please begin to act on it.
Thank you. Other questions? You want to add?
I wanted to add something. We are talking about a problem which is a social problem. We cannot forget that dimension, and equity is part of the issue between having places where you have a lot of monitoring and places that do not have monitoring, and which is very difficult. But still, the point that I wanted to make is that this has to deal with places where air quality inside and outside a house can be the same because of the ventilation is extreme. I recall a PhD thesis in South Africa talking about that. And I've seen part of that in southern Chile, where you have an enormous problem of energy poverty that implies that people are exposed both inside and outside to extreme levels of particulate matter. So equity is a dimension, and the social component of this is a dimension that we cannot forget, and that is needed in order to really address the question of participation, the question of political involvement, etc.
Thank you. My name is Dr. Ravindra Khewal, Professor of Environment Health, and I work in PGI Chandigarh. We run the largest network under Japan partnership known as ACAS project. We recently also used Purple Air and Atmos Indian sensor for validation, and the article is in NPJ. But the question here I wanted to raise here, from a health perspective, we have 8-hour, 24-hour, or 1-year guideline, basically. Even we saw the WHO guideline. So when you see, or in this, using these sensors, they represent 1 minute lag or other. And the population look at that, oh, the pollution level is so high. Then if you look at maybe on 24-hour, it might be 100 times less if you average it out. So how then challenging it become to communicate, basically, and how we can address such issues? Thank you.
I don't know who wants to answer. Obviously, if you have a 1-second resolution, that can be extremely high.
You are presenting this data on a SEM website, yeah. So you can, on the website, you can have real-time data, but you can also have average data, and then on that average you can compare this to the WHO 24 hours or to the WHO annual. So all that information can be there such that anybody reading this, so okay, it's a peak right now, I ignore this, but this how it compares to the WHO. So really, and with many of this, is really how you present this on the website. Even this issue that the sensor malfunctions right now. We had a problem like this. We ran a project using monitors. We developed Koala, PM2.5, and CO sensors. They were distributed in different places, and occasionally a spider walked into this monitor and was showing something like this. But then if this happens, we also had an automatic code showing something's out of range, and it was changing the color. So anybody looking at this sees and can say, okay, it is red. It's not red because it is, but read this. There's a problem with the sensor. It's very easy to build this kind of things such that it doesn't create problems to anybody looking at this.
Okay, thank you. I would share what you just said. I think we have methodologies now that can correct near real time and make sure that we are not ending up in a situation where public say, okay, this is very weird and this is when it's not true. So I fully share that. I think we have to stop. Unfortunately, I see that people are waiting for the next session. So I would like to thank all speakers and panelists for their time and their valuable comments and reflection. And thank you very much. We can clap. And before we leave, I would ask the two speakers, Pierre will have a picture with everyone so we can post it somewhere.